Welcome to your 4-minute masterclass on heart failure.
We will define the critical differences between left-sided and right-sided failure.
Focus on these key signs, symptoms, treatments, and nursing priorities. Let's begin. Left-sided heart failure is where the problem starts for most patients.
The left ventricle, our heart's main pumping chamber, weakens and can't effectively pump oxygenated blood out to the body.
This creates a traffic jam, causing blood to back up into the lungs.
Remember this key mnemonic: L for left equals L for lungs.
This backup, known as pulmonary congestion, leads to a cascade of respiratory symptoms. Patients will experience dyspnea, which is difficulty breathing, and orthopnea, the inability to breathe easily, unless sitting up straight or standing. When you auscultate their lungs, you'll hear crackles indicating fluid. They often develop a persistent, hacking cough, and in severe cases may produce pink, frothy sputum, a classic sign of acute pulmonary edema. Overwhelming fatigue is also common as the body is starved of oxygen. Pharmacologically, we manage this with the core trio: ACE inhibitors, which end in pril, to relax blood vessels; beta blockers, ending in OLOL, to reduce the heart's workload; and potent loop diuretics like furosemide to aggressively pull fluid off the lungs. Now, let's shift to right-sided heart failure. While it can occur on its own, it's most commonly caused by long-standing left-sided failure. The right ventricle becomes overwhelmed as it tries to pump blood into the already congested lungs. Eventually, it weakens and fails, causing blood to back up into the body's venous system.
For this, our mnemonic is R for right equals R for the rest of the body. This systemic congestion manifests as widespread fluid retention. You'll observe significant swelling or peripheral edema in the legs, ankles, and feet.
If the patient is bedridden, this fluid can accumulate in the lower back, known as sacral edema.
This fluid overload causes rapid weight gain, a critical indicator to monitor.
Another hallmark sign is jugular venous distension, or JVD, where the neck veins become visibly swollen. The congestion can also affect the GI tract,
leading to a fluid-filled abdomen, called ascites, which contributes to anorexia and nausea as the patient feels constantly full and uncomfortable. Nursing interventions and patient teaching are paramount in managing heart failure and preventing readmissions.
Your priorities revolve around meticulous fluid management. This includes obtaining daily weights at the same time each day. As this is the most reliable indicator of fluid retention, implement a strict low-sodium diet, typically less than 2 grams per day, to prevent the body from holding on to excess water.
You will also enforce a fluid restriction as ordered by the physician and maintain a strict intake and output record.
To ease breathing difficulties, always position the patient in a high Fowler's position. Patient education is just as crucial. Stress the absolute importance of medication adherence. Teach them to immediately report any worsening symptoms, especially a weight gain of 3 or more pounds in 2 days or 5 pounds in a week. Finally, empower them with lifestyle modifications, including smoking cessation and engaging in light, regular exercise as tolerated to improve their long-term quality of life.
Let's test your knowledge with a common NCLEX style question. A nurse is caring for a patient with new onset shortness of breath, crackles in the lungs, and pink frothy sputum. Which condition is the priority?
Is it A, right-sided heart failure, B, left-sided heart failure, C, deep vein thrombosis, or D, pneumonia? The answer is B, left-sided heart failure, because all signs point to pulmonary congestion. Remember, left double lungs,
right rest of the body.
Review the answer key now. Study complete.